Alright, we're live, Dr. Emer.
Hey guys, it's Dr. Emer. Come in close. I'm going to show you what we're doing right now for our male sort of skin rejuvenation and acne scar improvement. We've been working over the past few years just to keep him looking young, to help prevent aging, but also to improve his scars. We're using Halo today, which is our only hybrid fusion laser in the United States that can treat both the deep layers and the superficial layers of skin. You guys can see the snapping on the skin. That's the superficial erbium laser. That's going to peel and going to improve the pores, the fine texture, fine wrinkles, and the ice pick scars. The red area that you guys see is the 1470 nanometer wavelength. That goes deeper. You don't see the result as immediately. You see that more as time goes on, and that's what he was describing to me, that over the past 6 months of COVID and being home, he still noticed an improvement in his skin. Even though he didn't do treatment, because our collagen production was still going. Tell everybody, what were you noticing a little bit, like with the skin over that time?
Every few days, tighter, color difference, scarring would adjust to the size.
Perfect. So yeah, you notice like the scars would reduce, the pores would reduce, he felt tighter skin. I mean, we've been treating his skin now for few years, and it's a significant improvement in texture, in tone, in color. He does a lot of peels and microneedling radiofrequency between, which keeps him tighter and just more contoured. And then we continue this treatment every 3 to 4 months.
They're asking, is it painful?
How does it feel?
Zero.
He is like super trooper over here. He never has any pain. We do have nerve blocks in, those hurt. And he did this topical cream twice for about 45 minutes. And we're going pretty close. You know, there's going to be a little bit. Some people are more sensitive than others. But with the numbing medicine, it makes it much more reasonable. I'll add a teeny bit more numbing medicine when I do the profractional laser, because that's a lot deeper. But as this is going, you guys, you can see little dots are being put into the skin. Each one of those dots is going to peel and make the surface of his skin brighter. And that's the goal, is literally just remove, lift sun damage. That's what we want to do.
They're asking, when do you start seeing results?
Well, the results are seen in a week right after he peels. But again, as we said, it continues. This is not an individual treatment. If you had really severe scars, you would do 2 of these closer together, and then you would sort of space it as a maintenance. Here, we're already maintaining, so he's going to do this probably every 3 to 4 months, and then he'll do his Morpheus refractora and his peels in between. I'm a little red. Look at my skin right now, you guys. It's a little red, and I'm lightly peeling because I've been doing my Aerify peel. So he could do that even in a week and enhance the outcome. Like right when he peels, he could apply Aerify at home and enhance the results. And that's why we made that, because we just want to get continued collagen production.
And where can they buy Aerify?
You can get Aerify at emercosmetics.com, which is our website. You can also email directly to Lindsay at ACNE.com if you can customize a full skincare regimen for you every day. On emercosmetics.com, we have free virtual skincare consults. So if you're far away and you can't get here and you have questions, let's have one of our skincare specialists make a plan for you, and we'll send it to you anywhere in the world. We're going all the way up and down, full area, halfway done on this side. But his skin does very well to this. He's light skin tone, light eyes, so you can do a lot more.
They're asking if you have to be more aggressive in certain areas and less aggressive in other more sensitive areas.
Of course, yeah, that's the art of doing laser. That's why you go to somebody who knows how. With him, we're kind of being aggressive all around because he really wants more of an improvement because of his scarring. We also want to get some tightening on his neck. So he's willing to go to all the full and do it as much as possible. That's what we're doing. this skin type heals very well. Some of the key ingredients, you guys, on emeragecosmetics.com, we have an ablative laser package. That's kind of my go-to for everything you should use afterwards. If you had to limit the things you would use, I would use a vitamin C, like our AOC or our Fluorescin CF. I would also use Phyto Plus, which is a kojic acid, and I would use your growth factors and your stem cells. So anti-age MD plus accelerator and refit face and eye are what you should use at least at a minimum, and add in LED therapy and you'll get even more out of the treatment. You'll feel much more quickly.
Great.
Hyla B, which is hyaluronic acid from Emerald Skin, is very concentrated vitamin B and hyaluronic. That will help you stay very hydrated and heal more quickly as well. This is a good product. Another option is the SkinCeuticals B5 or the Is Clinical Hydro Cool. So we have lots of options, you guys. That's why we're the best. So definitely consult with us virtually at emeragecosmetics.com. Send an email to appointment at emerag.com, or just PM us and we'll get you going. But this is my long-term patient. Is doing absolutely amazing. I'm going to keep him looking good for however long he wants. And we have literally gone through war with fighting these scars. But I think we're basically there. I mean, now it's more just keeping you young. The scars are almost all gone. I'm going to clean the tip for a second, see what happens. All the dead skin cells and all the scars break apart and they get in there. So we have to clean this out. So now the laser works more efficiently.
So you talked about our post-care packages. What about our pre-care packages to prepare for laser?
That's a good question. Pre-care is really important. And someone like him, having light skin tone, he could actually do rev peels, which are TCA phenol peels, and really get rid of the upper surface. Or you can do at-home lightening peels like Cosmelan and Lighten or Aerify, which we can do virtually. Definitely be aggressive with Cosmelan 2, and definitely be aggressive with sun protection. I really like the face and the Restorci lines for maintenance of your skin, the softening. So using the Restorci 10X with the liquid gold and using the face moisture rich gel and lotion are really good beforehand as well. And then after, if you want a barrier repair cream to mix with your peptides, you would use this Sente. Now he's also going to treat his neck, so I would add the pressed contour serum for his neck, which I use every day. It's a very strong hydration from Sente of 3 different hyaluronic acid derivatives that moisturize and tighten the skin. Probably the only skincare product of Contour Press that's ever been shown to tighten skin. Alright, last few passes and we move on to the other side. So we're getting to the end of the halo for you guys. What other questions do you have before I get there?
Can you talk about the dots that are forming in the skin?
Yeah, all those little dots are the erbium. That's a superficial laser. You can see it's like cheese grating in his skin. Those are all going to peel and look like little holes. The holes will remodel with new collagen, and he's going to have softer, brighter texture. This has to be done in certain skin types because you don't want to risk hyperpigmentation, and you also want to improve the skin without risk of burn or scarring. You don't want to worsen the scars. You see all that fine pinpoint bleeding, you guys? That's the deep dermis heating and getting collagen production. He's going to get an amazing result. Also, some of the bleeding is sun damage, and those are fragile skin cancer, potential skin cancer cells. By doing this, we get rid of those and keep him fresh so that he doesn't get a skin cancer. Remember, I was a dermatologist that did a lot of skin cancer surgery first, so I really care about my patients' prevention, which is doing lasers to make you look good, but also you don't get skin cancer. Alright, perfect. Now we're going to switch sides. So that's it. We're going to stay showing you guys. We will be showing profractional in a few minutes for the deep stretch. They're all the way right. And then hold the ice on the left. Perfect.
When are you going to start something?